Hey.
I am, yeah.
All right. Well, good morning, everybody, and thank you for joining us. My name is Drew Gattine. I am the chair of the Maine Democratic Party, here today to talk about healthcare. If you've been following what we at the Maine Democratic Party have been saying about the candidates in this year's gubernatorial election, you'll know, not surprisingly, that there are a lot of differences between Governor Mills and Paul LePage. However, it's really a struggle for me to really think about an issue in which they are more different than the issue of healthcare. And let me put it bluntly, because I served for years in the Maine legislature when Paul LePage was governor. For 8 years as governor, Paul LePage waged a war on the health of the people of Maine. Let me give you some examples. He vetoed Medicaid expansion not once, not twice, but 5 times. And even after Mainers voted overwhelmingly in 2017 in a referendum, he refused to implement it. He vetoed a bill to fund it. He was sued about that and lost. He prevented those 95,000 Mainers from accessing health care. And that was probably, in my mind, his biggest priority as governor, was denying health care to those 95,000 people. According to the Bangor Daily News, he, quote, squeezed the life from Maine's public health system. Not filling positions for public health nurses and many others, and fighting against efforts in the legislature to raise public health nurse pay. And while fortunately Roe v. Wade was still in place when he was governor, he did what he could to undermine access to abortion and other reproductive care, including by cutting funding for the state's family planning agency. Thankfully, in contrast, since Governor Mills was elected in 2018, we've reversed course. We've reversed the curse, if you're a sports fan. Everything changed. She expanded Medicaid on day one, leading to the nation's single largest drop in the rate of uninsured people. She revitalized and rebuilt our public health system just as the pandemic or prior to the pandemic, and led one of the strongest COVID responses in the nation. And she safeguarded access to reproductive care in the state, requiring health insurance providers to cover abortion, and pledging to defend abortion rights in the wake of Roe being overturned. As a result of Governor Mills, Mainers finally have access to the care that they need and that they deserve. Yet with former Governor LePage on the ballot this November, that's all at risk. After his obstruction of Medicaid expansion, we can't trust him to ensure that all Mainers have access to health care. After his destruction of our public health infrastructure, we can't trust him to protect us in a health crisis. After his loud opposition to abortion rights over the years, we can't trust him to protect reproductive freedom as his Republican allies are clamoring to take it away every single day. So it's clear that for the sake of the health and safety of Mainers, we must re-elect Janet Mills. And today I'm joined by a number of healthcare professionals who can tell you exactly why that is and what's at stake. So first I'm going to bring up Patsy Leavitt, who could talk about how beneficial Medicaid care expansion has been and what's at stake if it were to be repealed. So Patsy, why don't you come up? Thank you.
Thanks. And thank you. Healthcare is a human right. This is a mantra I've carried in my heart for 45 years as a nurse and a nurse practitioner. And in those 45 years, I've worked in emergency rooms and urgent cares and clinics, and I've seen the devastating consequences of the lack of healthcare in our most vulnerable patients, those who are uninsured. I've looked into the eyes of an uninsured sick patient who put off care because they didn't want to get a bill that they couldn't afford. I've seen the desperation on their face when they're faced with the untenable choice of buying medication or feeding their family. As the research will verify, uninsured persons die younger. They delay preventive care, and they put off treatment until their problems are extreme. For these reasons, 20 years ago, with the help of family, local businesses, and neighbors, we opened a free clinic over in Buxton. We knew that our clinic was not the best answer, but we hoped to provide a safety net while we waited for the healthcare system to fix itself. We knew that it should not be needed, and we hoped for the policy changes that would put us out of business. Our very first patient dramatically demonstrated the need for these safety net services. She'd been dealing with a fairly minor infection over time, which she was treating at home. She avoided going to the urgent care or to the emergency room because she said, "I don't want to get a bill I cannot pay." She showed up at our clinic and she was very sick. In fact, her condition became life-threatening. We were able to treat her and move her along before she had to go to the hospital, and she was not hospitalized. Over the following 16 years, her story was repeated time and time again, over 2,000 times. We saw women who had not had cancer screenings for decades. We got access to mammograms and pap smears for these women. And yes, we saved some lives because we detected early cancers. We help people take control of their blood pressure, cholesterol, and their diabetes, major risk factors for early death. And we help people to afford expensive medications to avoid problems and to keep them working and functioning in their homes and workplace. When the Affordable Care Act was launched by President Obama in 2010, we were encouraged and hopeful. We assumed our patients would be able to be taken care of and we would be able to shut down. We waited for Maine to open up and expand Medicaid and Maine Care. However, as you've already heard, tragically, the administration at that time did not opt to participate. That despite support from the legislature across the aisle and the Maine people. So we carried on and we had golf tournaments and fundraisers and begged for money and wrote grants to survive. We had 30 volunteers and a part-time staff person working to move mountains every day to help people. When Governor Mills was elected, she vowed to right this wrong, and she made good on that promise. And Maine Care was finally expanded in early 2019, and we prepared ourselves to go out of business in a good way. So now, in this election year, I ask myself daily, what would happen if the Maine Care expansion was repealed? You've heard the statistics. Thousands of Mainers would join the ranks of the most vulnerable residents, the uninsured. And contrary to popular belief, they would not be clogging up the emergency rooms every day with their minor problems. No, these folks disappear. And they fall into that dark underbelly that's our shame in this country. I can tell you that I know 2,000 people, and I know what they would do. They would parse out their pills and their insulin and their inhalers and make them last as long as they could. They would skip their cancer screenings and preventive appointments. They'd miss days of work because they were sick from their chronic illnesses. And then maybe they'd show up in our ERs really sick and near death. Or perhaps they'd simply die prematurely. I've been asked whether eligibility for Maine Care should only be available to persons who are in the workforce. Without getting into what's work versus workforce, my answer is a resounding no. For if healthcare is a human right, like other rights, it should not be predicated on employment status. And finally, I'm really concerned and confused by the confusion of terms when people equate Maine Care or Medicaid with welfare. Okay? Healthcare equals wellness, not welfare. And Maine Care is healthcare, and healthcare is a human right. Thank you.
Thank you, Patsy. Our next speaker is Julie McDonald, who is a family medicine doctor in Central Maine. Julia, thank you.
Hi, my name is Dr. Julia McDonald, a full spectrum family medicine physician, which means I take care of people from cradle to grave, all ages, all walks of life. My days are full of helping people manage their diabetes, providing prenatal care and contraception, and doing well child checks, often for babies that I've delivered. I'm also an abortion provider because I want to support my patients in creating a life and a future for themselves and their families on the time frame that works best for them. For me, medicine and politics intersect in multiple planes. Insurance coverage and medical costs, the stability of the medical and public health systems, and with laws that are passed that either interfere with or support my ability to do my job with my patients. Governor Mills has never equivocated in protecting Mainers' access to full spectrum healthcare, which means she directly supports Maine people and Maine's healthcare providers. In her first year, Governor Mills signed legislation to expand who can provide abortion care, including my very skilled advanced practice clinician colleagues like NPs, PAs, and midwives, to increase privacy protections for the licensing and privacy information of healthcare providers, including abortion care providers, and to mandate state and private insurances to include abortion care in their maternity care coverage, because abortion care is healthcare. Contrast this with former Governor Paul LePage, who during his 2 terms cut funding to family planning organizations, attended anti-abortion rallies, and in 2018 said, "Let's do it," in response to the idea of overturning Roe v. Wade. He is also on the record as saying, "We should not have abortions." Let me interject that there will always be the need for abortion care. The question is not having it or not having it. It's whether abortions remain safe, legal, and accessible to those who need them, and whether we show up to support people who have abortions. Do not let his evasion of the issues fool you. If reelected, Paul LePage will restrict access to contraceptive care and abortion care in the state of Maine. The language and intricacies of policy and legislation often feel very distant from my exam room and for my patients. But let me tell you a quick story about a patient who directly benefited from Governor Mills' steadfast work to improve access to health care. Under Paul LePage, before abortion care was included in state insurance coverage, patients with Maine Care sometimes had to scrounge money to pay for their procedures, sometimes causing unnecessary delays and financial stressors, groceries and rent, or health care, child care and heating oil, or health care. I remember the joyful, astonished gratitude of a working mom of 3 young kids who learned that Maine Care would pay for her abortion. She was able to get in early, have access to an abortion with pills that she could do in the privacy of her own home and the contraceptive of her choice, and return to her busy life. This was a marked juxtaposition for the scores of patients with Maine Care who in the past would have had to delay access to care, sell furniture, work additional hours, and borrow money just to get healthcare services. Governor Mills is truly a champion for the people in this state, consistently working to protect and expand abortion care. If you care about families and communities, she is the best option for the future of Maine. Please vote for Janet Mills on November 8th. Thank you.
Thank you, Doctor. Next up is Sam Zager. Sam is a state representative from Cumberland County and is also a family medicine physician. Thanks, Sam.
Thank you very much, Drew. Good morning, everyone. I'm very pleased to be here today to fully endorse Governor Mills for re-election. In addition to the path-breaking expansion of general health care that we've heard about and her work on reproductive access to reproductive health care, Janet Mills has been an incredible public health governor. When she came into office in early 2019, Governor Mills immediately appointed and resourced a dream team at the Department of Health and Human Services and the Maine CDC. We on the legislature's Health and Human Services Committee, we have oversight and a front row seat to this work. And I can tell you that Governor Mills and Commissioner Lambrew's execution and leadership have been absolutely top notch. Then in 2019, as we do now, we faced a grim opioid epidemic. In the face of that, the prior LePage administration, prior to Governor Mills, had emphasized a failed approach seeking to punish, frighten, and marginalize Mainers who are suffering from opioid use disorder. And Mainers continued to suffer. But Governor Mills came into office and appointed Gordon Smith, the director of opioid response. And together, they improved Maine's approach to that epidemic by adopting a treatment-based approach to address what the whole country has been struggling with. This is in line with best practices and the best policies by bipartisan legislatures all across the country. I know this because as I'm a National Conference of State Legislators Opioid Policy Fellow, and I've worked with legislators from all across the country, Republicans, Democrats, Independents, focusing on common sense solutions to real problems that we all face, including here in Maine. And Governor Mills's approach has been very consistent with those practices. For instance, the easier distribution of naloxone hydrochloride, Narcan, as it's often known, which she did when she was the Attorney General and took on the Governor LePage, who was then governor. After COVID-19 hit our state, which was about a year into her tenure in her first term, we were facing a really grim situation. Demographically and for other reasons, Maine was actually quite vulnerable. But as I know from my service in the Navy, you can have stormy seas, but good leadership on board will help you get through and get to port safely, which benefits everyone on board. So I'm tremendously grateful and appreciative of Governor Mills's leadership during the COVID-19 pandemic. She took us, some of the work that she did was preliminary, wise anticipation of what was going to happen. We've heard a little bit about what she did with the public health infrastructure, expanding the public health nursing force, for instance, which she had to do because her predecessor had naively eviscerated that infrastructure. So let me just repeat. Paul LePage systematically eviscerated and diminished our public health infrastructure, and Janet Mills wisely set to work reconstituting it. And then with this infrastructure in place, she and her administration, even when it got tough, even when it got scary for all of us, demonstrated tremendous leadership in public health. And as a result, Maine has fared extremely well. And don't just take my word for it. Go to any of the evidence-based resources that are out there that look at the actual numbers, and you can see how well Maine has done. Whether it be vaccination rates, whether it be survival or hospitalization rates, Maine is at or near the top. And that doesn't happen accidentally, especially given what we were facing at the beginning of the pandemic. So I'm just going to close by saying that Governor Mills has been a phenomenal public health governor, in addition to her other leadership in other issues. And I commend to our entire state to re-elect her this year. Thank you.
Thank you, Representative. We'll take some questions. Yeah. And
I